Executive function batteries are useful because there are a number of different behaviors or skills that make up executive functions. And so, for example, a screening test may only have one or two instances of behaviors that address executive function, so something may be left out. The cognitive linguistic quick test as a screening measure, I think, does a decent job. It contains a fluency naming task, a maze task, which requires planning, and a design generation task, which I have an image on the page here, and I'll describe a little bit about how that works. I gave you a table here, or a copy of a table of different authors' conception of executive function in terms of the main components that they consider make up executive functions. And I put it there to show you that there's some variability in how executive functions are conceptualized, but there's also a lot of overlap and some recurring themes there. The two most common executive function tasks given, I think, are the Dellis-Kaplan and the BADS. The BADS is probably more commonly given in speech pathology clinics because it's purported to be kind of focused more on functional skills or testing in a way that addresses functional skills. Where possible, I've given you some examples of these tasks. For example, the trail making task. The verbal fluency test, just to remind you, one of the things that we see in verbal fluency tests, trying to name as many items in a category as you can in a minute, or as many words that begin with a letter. People who have good executive function skills, you'll notice some kind of strategy in their naming. So, for example, if I was to ask you to name as many words that begin with the letter S in a minute, I might notice that you were kind of taking a syllable and working off of that. So if I asked you to name as many words that begin with the letter S, you might say soul, solely, solitary, etc. Same thing with category naming. If it were animals, I might notice you move from naming as many farm animals as you could to animals that you would see in the zoo, etc. And so people who have executive function problems, we may not see just fewer items being generative, because one of the qualities of executive function is kind of generative thinking, but we may also notice that they don't appear to have a strategy. In general, patients with frontal lobe damage tend to have poorer performance on letter naming, letter verbal fluency tasks than semantic or category fluency naming tasks. The design fluency task here is nice for people with aphasia because it's nonverbal. And as I mentioned previously, people with aphasia can have some mild executive dysfunction, particularly if they have large lesions that have invaded the frontal lobe. In this task, you're asked to make as many designs using the 4 lines. You have to use all 4 lines. The patient's instructed not to repeat any designs, and so they have to be good at monitoring themselves and noticing whether they've made this design already, and that's actually more difficult than it sounds, and they're asked to make as many as they can under a certain time limit. In the Dellis-Kaplan, I mentioned that it measures concept formation. So concept formation, what we'll see in patients who have problems with concept formation is they have difficulty thinking abstractly. So the responses will tend to be concrete. And so, for example, in a Proverbs test, a proverb doesn't mean explicitly what it says. We have to be able to take those words and think abstractly and develop a concept of what they mean rather than being locked into the literal meaning. So that's concept formation. Reasoning is really just kind of the ability to think logically. And so reasoning we can think of as fitting underneath problem solving, in that problem solving requires generative thinking, thinking of multiple solutions to a problem. Each one is logical, right? So there's a reasoning involved in that. The bads, we have some description here. Finally, there is a test, the Behavior Rating Inventory of Executive Function, that can be given to patient and caregiver as a self-report measure. You can also notice the difference between the patient report and the caregiver's report and your own observations.